Now, sepsis is a medical emergency that must be treated as aggressively as a heart attack or a stroke. Sepsis can happen to anyone, but early detection and aggressive treatment is certainly the key. So joining us right now is Sepsis Coordinator at HCA HealthONE Mountain Ridge, Pietriyk. Andy, thank you so much for joining us. We appreciate that. First, we were talking a little bit about what exactly sepsis is. Not many people know about it. And why is it considered a medical emergency?
Well, it's considered a medical emergency because it can lead to tissue damage, organ damage, and potentially death if it gets far enough along.
Yeah. So what is sepsis?
So sepsis is the body's abnormal, overwhelming response to an infection that, like I said, can cause tissue damage, organ dysfunction, and ultimately lead to death. It's really just the body's immune system in overdrive mode.
Yeah. When do you see cases of sepsis a lot?
Well, I work in the hospital, so I see cases of sepsis on the daily basis.
Sure.
High-risk groups include the very young, so infants, people over the age of 65, people who are immunocompromised, so think cancer patients that are on chemotherapy. Those are a lot of the big ones. Other at-risk groups are ethnic and racial minorities, as well as people in lower income groups.
Yeah. Can sepsis or can symptoms look different between kids and adults for sepsis?
The symptoms, honestly, are, first of all, in children, they're harder to see because oftentimes infants can't tell us how they're feeling, right? So what we're looking for is changes in temperature, a very high temperature or a low temperature, increases in heart rate, so if the heart's beating really fast or really hard, increase in breathing rate, so you notice that somebody's breathing faster or harder than normal. Those are all signs that you would look out for, and potentially, especially when those things are linked up with an identified infection. So if somebody, again, is having trouble breathing, or if they've been vomiting or having diarrhea for days, or if they're having trouble with their urinary system, or if they have an open wound, those are all things that would be concerning for infection that could lead to sepsis.
Interesting. Why do so many of these cases go undiagnosed?
That's a great question. I think oftentimes people wait too long. It's not necessarily that they go undiagnosed, it's that they're identified late. And the later sepsis is identified, the harder it is to treat and the worse it can become and the higher the risk of, again, that permanent organ dysfunction. So yeah, early detection is key.
Yeah. In terms of diagnosing this and in terms of treating this, you have the body that's going on overdrive, right? So how do you treat this?
So the cornerstone of treatment for sepsis has been the same for a very long time, and that is early and aggressive, appropriate antibiotics.
Yeah.
So other cornerstones of treatment include IV fluids, and then of course blood cultures, which it's a blood test that we do to really identify if there's a bloodborne pathogen or bacteria in the blood that we can treat with antibiotics. So we really try to narrow down what is that pathogen, right, or what's causing the infection, and then making sure that we're giving the appropriate antibiotics for that.
Very interesting. So this month is very important, right? I'm sure it's for sepsis awareness, correct?
That is correct.
Yeah. Why is this month so important?
So September is Sepsis Awareness Month. And I think one of the most important things we can do for sepsis is to increase the public's awareness of sepsis. It's one of the statistics I most recently read is that 30% of the population has never even heard the word sepsis. And so that's why we're here today in September talking about sepsis.
Yeah, I mean, when we hear about it, it sounds very serious, but even for me, I didn't really know much about it.
Right.
And you see cases quite a bit, right? You see, how many cases do you see a month?
So we see on average about 60 cases of severe sepsis or septic shock a month.
Yeah.
That's not even including the simple sepsis.
Yeah.
So 60 cases come through the emergency department where I work every month.
Wow. All right. So it's a good time to be aware of sepsis for sure.
Yep.
Andy Pietriyk, thank you so much for joining us. We appreciate it. Thank you.
Thank you for having me.
Yeah, and you can watch all of our interviews, by the way, on our website. You can go to cbscolorado.com.
Well, to sum up a judge's words in Memphis,